thought I was special, but apparently I share my problem with 40% of the population. 40% in their lifetime. And that doesn't mean they have it all the time. It means it kind of comes and goes, and sometimes it comes quickly and goes quickly and they never have it again. But the people alive now, 3 billion people will have sciatica, pain in their leg, in their lifetime. As opposed to the 80% of back pain sufferers, of which on the planet there's going to be 6.2 billion. That's a big number. This number here, and both these numbers, they're the same. They're connected. They're not independent of each other. They're the same. It's not the same number, but it's the same problem. This number used to be 70%, and it's crept up to 80%. And one of the reasons it's crept up to 80% is because we live in a culture where we're sitting all day long. And sitting overloads your back, loads the discs, and starts to cause a disc problem. We give you tips. The reason we give you the tips is because there are things that you do every day that make your back pain worse. One of them is sitting, and one of our tips is how to sit. But also what you need to do when you sit for too long. Stretches and things like that. Number 2, most common cause. We've talked about this a lot, so you may already know it, but the most common cause is the herniated disc. Herniated disc is where the disc comes out between the vertebrae and pinches the nerves. And one of the things that we know is sciatica is a pinching of the nerve. Sciatica is the name of the symptom. It's not the cause. Pain down the leg is a pinching of the nerve. The cause is, in this case, the number 1 cause is the herniated disc. Number 2 is stenosis. Stenosis is a wear and tear over time, part of the degenerative process. Tends to happen more with people that are a little bit older because the spine starts to wear out over time. But it can happen when you're younger, depending on if you've had a lot of trauma or not. But the other 3 reasons are the bulging disc, the degenerated disc, and spondylolisthesis. Those are the main causes. But number 1 is the herniation, pinching the nerve. Number 2 is stenosis, opening physically starts to tighten up on the spinal cord. Number 3 is a degenerated disc. Number 4 is the bulging disc, kind of like a flat tire. And the last one does happen, and it might be the most severe because it's really causing a shifting of the vertebrae, is what we call the spondylolisthesis. The sciatic nerve, where does it go? It starts in the upper back, starts in the low back, but it comes out and then goes all the way down your leg. It's the longest nerve on your body, and it's the biggest nerve on your body. And we're going to talk in a minute about all the nerves that form the sciatic nerve, because it's technically not one, but when they come together, the thickness of the sciatic nerve as it exits the spine and starts to go down the leg is about this big. Okay? It is the largest nerve on your body and the longest nerve on your body. And because of that, it will start to cause you a lot of trouble. Now, the next slide we call sciatica spaghetti. Partially because I'm hungry. It's dinner time. I gotta eat. But there are nerves, the quick anatomy lesson. Head, hips, 24 vertebrae. Inside the spine is the spinal cord. Spinal cord starts up here and works its way all the way down to the bottom. And in between each vertebrae, there is a nerve that exits directly off of the spinal cord. So these nerves exit off the spinal cord and they go to different parts of the body. Now the nerves in the low back go down the legs. And the sciatic nerve is made up of 5 different nerves. It's not one nerve, it's 5 different nerves. Kind of looks like this. 1, 2, 3, 4, 5. These lower ones are not the sciatic nerve, but these 5 are the sciatic nerve. And the sciatic nerve comes out of this vertebrae, and this vertebrae. And then there are 2 other ones that come out below that. Okay? So these nerves will get pinched. And these nerves, as they get pinched, will start to cause you pain. But they come out of this portion of the spine and they form into one very large nerve, which is what this is right here. And this is important because the next 3 facts are about the spaghetti. Because it's not always one nerve that's pinched, sometimes it's multiple nerves that are pinched, but each nerve is responsible for a different type of symptom. So what does that mean? It means that because there are so many nerves, and nerves control all sensation and motion, that very often when a specific nerve is pinched, you'll get a specific type of symptom. But depending on which part of that nerve is pinched, you might get different symptoms. I know it's a little bit confusing, but some of the symptoms you might get are a stabbing pain. A lot of times people say it feels like someone's stabbing me in my glutes or down my leg. Or you'll get a sharp pain, where you get a sharp pain, or sometimes you get a shooting pain, where the pain shoots down your legs. You'll get numbness, because nerves tell the brain what's going on, and if the nerve is being pinched, it doesn't give any information to the brain, so it feels like the leg is numb. So you get numbness. You get tingling. You get a tingling sensation. Sometimes patients say to me, it feels like there's bugs crawling on my leg. That's kind of the tingling sensation. Sometimes you get a dull ache, like a toothache. Pain, a dull ache in the leg. Sometimes you get burning. We had one patient who said, yeah, it just feels like my feet are on fire. I feel like I'm burning on my feet. Okay? Didn't have traditional pain that went down the leg, just had burning in his feet. Well, the low back, he had pinched nerves on both sides, causing his feet to feel like they're burning. Muscle weakness. These are all the symptoms that you get from sciatica. So it's not just one, it can be all of them.